Welcome to iMedtac. Take a look around our office.
E-health takes the healthcare industry to new heights. Just like how walking up a hill past terrace after terrace allows you to see an entirely different view, e-health brings a greater degree of gentleness to medical care. There's a greater level of dignity. It can enhance the effect of clinical medical care and heighten the industry's efficiency. It changes the communication between doctors, nurses, and patients. iMedtac focuses on developing e-health to inject renewed vitality into the health industry.
At iMedtac, we transform healthcare through AIoT by combining our team's in-depth knowledge of hospital and care facilities needs and years of experience with AIoT and system integration. Today, we'd like to introduce our care recipient monitoring solution. Please enjoy a quick introduction video of the product.
Preventing care recipients from falling is a task that requires significant manpower for medical care. By adopting a smart AI monitoring system, we can reduce the chances of such incidents occurring and boost the work efficiency of nursing personnel.
As I mentioned, our care recipient monitoring system uses AI algorithm to analyze 3D depth images collected from the time-of-flight sensors to determine whether a resident is in bed, near the edge, out of bed, or has fallen. We have updated our model to adapt to some of the most common scenarios at care facilities, especially for a resident who does not have caregiver by his or her side 24/7. For example, a fall event likely occurs when a patient wakes up and suddenly feels dizzy, or leave event would occur when a patient gets up to go to the bathroom. We have partnered with care facilities to use our care recipient monitoring solution to fulfill some of their needs. One of our clients, Lily Group, a long-term dementia care facility in Elon, they want a solution to remotely monitor their residents' status and be alarmed when assistance is needed, such as a fall or leave event in the middle of the night. They also want to better understand the residents' daily routine to provide a more personalized care and update their families. Let's take a look at some interesting cases. This is a compilation of activity graphs of an elderly resident in Lily over 3 days' time. Each dot represents one of the 4 statuses. As you can see here, that this elderly's daily routine is relatively regular, meaning leaving and returning to bed at consistent times. However, this elder's sleep patterns are somewhat short, as she consistently gets up in the middle of the night to go to the bathroom. Since this elderly takes sleeping aid pills before bed, she could be more prone to losing balance or need assistance when she gets up in the middle of the night. So the caretakers find our system valuable, as it alerts them this elderly has left bed for more than 5 minutes. You can also see that she gets up at 4 or 5 a.m. and returns to bed for some rest at around 8 a.m. Last but not least, she actively participates in activities planned by Lily in the afternoon, such as picking vegetables, watching TV, or singing karaoke in the living room, and only returns to bed for rest at around 6 p.m. On the other hand, if we place resident A's activity graph next to resident B's activity graph, you can easily identify that resident B's activity level is relatively lower than resident A's. You can see this by the low number of leave bed statuses in orange in resident B's activity chart. Caretakers can use the daily living charts to monitor any changes in residents' routine, allowing them to provide assistance as soon as possible. By leveraging AIoT, our care recipient monitoring solution was able to improve residents' living experience after having more insights into their daily routine, as well as providing care recipients' family members a peace of mind when away from their loved ones. Last but not least, it increased residents' safety by being able to alarm caretakers if any resident requires urgent assistance.
Care recipient monitors the daily routines of residents, thus improving the efficiency of the nursing staff's care. It allows care recipients to receive better medical care and bring greater dignity to their lives.
We hope you enjoyed learning about our care recipient monitoring solution. Reach out to us at sales@iMedtac.com for any additional questions.